So far, we've explored what person-centered values are, how they are applied, and the benefits they offer to both service users and service providers. Click the pop-up to watch those videos. In this video, we will focus on the effects when person-centered values are not applied. Person-centered values are essential in health and social care settings for promoting the overall health and well-being of service users, but when person-centered values are not applied, it can have serious effects on a person's physical, intellectual, emotional, and social well-being. For the exam, you need to include examples from a range of health and social care settings and analyze the effect and explore the links between the different aspects of PIES on person-centered values. Next, we'll explore how the absence of person-centered values can negatively impact an individual's PIES. If person-centered values are not applied, there would be no care plans to follow, which means service users might not receive the correct medication or treatment. For example, in a care setting, failing to give prescribed medication could cause unnecessary pain or worsen the individual's condition. Likewise, ignoring a person's specific dietary needs could lead to malnutrition or dehydration. A care plan is a written document that outlines an individual's specific needs, how those needs will be met, and who will be responsible for providing the care. Care plans are based on person-centered values, focusing on what matters most to the individual by incorporating their choices, preferences, and personal goals. Without personalized care plans, individuals may be placed in environments that fail to accommodate their mobility needs or physical challenges, increasing the risk of injury through accidents or falls. Here's an example of a care plan. A lack of person-centered care could prevent a service user from accessing educational or developmental opportunities that align with their abilities and interests. This can result in a lack of progress and skill development. When individuals lack opportunities to learn new things, or participate in appropriate activities that support their development, their brains aren't sufficiently engaged. This can negatively impact their mental well-being, leading to feelings of boredom, low mood, or frustration. Over time, such inactivity may diminish a person's ability to function independently and negatively affect their overall cognitive health. This is because engaging in mentally stimulating activities help to strengthen connections between brain cells, enhancing memory, attention, and problem-solving abilities. For example, an older adult with early dementia may benefit from simple puzzles, memory games, or light reading to help keep their mind active. However, lack of mental stimulation through activities can lead to a faster decline in cognitive health. When the brain isn't regularly challenged, the neural connections that support thinking and memory can weaken, making it harder to learn new information, concentrate, or make decisions. This can accelerate the progression of dementia symptoms and reduce a person's ability to function independently. Without this mental stimulation, focusing becomes harder, distractions become more frequent, and processing information slows down. Over time, this can lead to a noticeable decline in your ability to concentrate and think clearly. When service users don't get the support or opportunities they need, they might not achieve their true potential. For example, someone with learning needs could do really well if given activities that match their abilities. But without those chances, they miss out on growing and succeeding. This is because providing the right support helps individuals develop skills, build confidence, and achieve independence, enabling them to achieve their true potential. The emotional well-being of service users can be significantly affected when their personal preferences and values are overlooked. When individuals receiving care are not offered choices that respect their personal likes, dislikes, and values, it can negatively affect their emotional health. For example, if someone is made to participate in activities they do not enjoy, they may feel upset, anxious, or ignored. Over time, this lack of consideration can lead to increased stress and a decline in their confidence and self-worth. Being compelled to engage in unwanted activities can make individuals feel powerless and unheard. This sense of lost control and disregard for their preferences can lead to emotional distress. Over time, such experiences may diminish their self-esteem and confidence, making them feel less valued and more isolated. When a person is consistently ignored or made to feel that their interests and preferences do not matter, they may begin to feel like they are not good enough, they don't deserve to be heard, or that they have nothing to offer. These feelings can deeply affect their emotional well-being, leading to anger, stress, sadness, frustration, or a sense of worthlessness. In some cases, this may even lead to more serious issues such as depression and persistent feelings of inadequacy. It is crucial for caregivers and support systems to acknowledge and honor the personal preferences and values of those they care for. By doing so, they can help foster a sense of autonomy, respect, and emotional well-being in individuals, ultimately leading to more positive outcomes in their care and personal development. When person-centered values are not applied in health and social care settings, individuals may experience a range of negative effects, including feelings of exclusion, loneliness, lack of social interaction, poor social skills, or becoming withdrawn. These consequences can significantly impact their emotional well-being and overall quality of life. In hospital settings, patients who are not involved in decisions about their care may feel excluded. For example, if patients are not consulted about their treatment preferences or discharge plans, they may feel that their opinions are not valued, leading to marginalization. This lack of inclusion can result in decreased satisfaction with care and a feeling of disconnection from the healthcare team. In residential care homes, residents who are not encouraged to participate in social activities or whose individual interests are overlooked may experience loneliness. For instance, if residents enjoy gardening but are not provided opportunities to engage in this activity, they may feel isolated and disconnected from others. This sense of loneliness can lead to depression and a decline in mental health. In home care settings, individuals who receive minimal interaction from caregivers may experience a lack of social stimulation. For example, if a caregiver focuses solely on completing tasks without engaging in conversation, the service user may have limited opportunities to practice social skills. Over time, this can result in diminished communication abilities and increased social anxiety. In mental health facilities, patients who do not receive personalized support may become withdrawn. For instance, if a patient's unique needs and preferences are not considered in their care plan, they may feel misunderstood and choose to isolate themselves. Implementing person-centered care practices is crucial in addressing these issues. By respecting individual preferences and promoting meaningful social engagement activities, caregivers can enhance the emotional well-being and overall quality of life for those in their care.